Hi, good afternoon. This is your Rockland County Executive Ed Day. We're here for our bi-weekly COVID-19 update. We have some good news. Finally, we're getting even better news as time goes along. Just a reminder, we will be putting links up to a number of the websites in the comments section of our Facebook page, our Rockland County Government Facebook page. But if you have a pen and paper handy, that might be helpful too for some phone numbers and some short notes you may want to take. I'm here again with our communications director, John Lyon, who's widely known as the man behind the curtain. He's been fielding questions for you, but I just want to preface the question period with a few statements. Number one, as most do know, we've officially entered phase 2 of here in Rockland and the Mid-Hudson region. It's a regional approach. There are 7 counties, of which Rockland County is one. Industries now able to open include offices, real estate, in-store retail, vehicle sales, leases and rentals, rental repair, or retail rental, repair and cleaning, commercial building management, hair salons and barbershops, and outdoor dining. That's something I'll be taking advantage of tomorrow night, to be honest with you. As we all begin to get haircuts, which I'm going to get one tomorrow also, try to get some shopping done, get back to work and visit restaurants, it is important to note that a lot of things are going to be a little bit different. We need to adjust to these new guidelines, and it's important to remember why. And I understand there's a lot of conjecture that's in part of this. You've heard the governor himself say he's not sure about things. The dynamics of this virus have been changing relatively often. What this comes down to, I'll be perfectly honest with all of you, this is a best guess scenario. What appears to have worked, what appears to have not worked, and adjustments are made going along. So, we're trying to comport with what the experts are giving us. The experts have been wrong, as we know, but the experts also, to some extent, have been right. So these are the best practices that we could come up with, and the goal here is to make sure that these procedures are put in place to protect not only your health and safety, but the health of your loved ones, your kids, your spouse, your grandparents, your parents. These are the people we're looking out for also besides you. The current schedule for the additional phases, just so people are aware of it right now, phase 3 is June 23rd, and the final phase, phase 4, is July 7th. I want all of you to know that we have what's called the control room meetings on a daily basis with the governor's staff and the 7 county executives. And that control, when we make it a case to speed up the process, because our numbers are currently very, very good. We can argue and advocate. We have gotten some things done quicker rather than later as part of that advocacy, which we're very proud of. But it's a difficult scenario in what we're dealing with. But we are doing our best to try to get the Albany to understand what the needs of our region is, and specifically the needs of our county here in Rockland. As far as testing is concerned, the testing rate right now, where of the tests that are being given, it'd be 800 and 1,000 on a daily basis. We're looking at about a 1.5% positive hit rate. That is a very small amount. It really is, especially when given the dynamics of this virus, where vast majority of people go through it either with no symptoms, mild symptoms, something like a cold or maybe a low-grade fever. We don't know, and nobody does know, why this virus seems to target people. The original issue was older people with comorbidity, other underlying causes. That is obviously not the case. We have younger people in their 30s, 40s, 50s who are getting this too. It just appears that it attacks certain people, and it can be a violent attack upon that person, and they don't know why. Many people get the same virus and have no symptoms. That is a challenge for the medical profession, and they have to figure this out. But the bottom line is that right now, in our hospitals, we have about 24 hospitalizations, where before we had hundreds of them. So it really has, we've done quite well here, but I want people to be assured that we're doing nothing that's reckless or haphazard here. We're not putting anything ahead of your health and your safety, and we're watching the data very closely to ensure we are moving forward with what we say here: safety first and people always. That is our motto here. And in order to further this idea, we just don't talk about these things. We don't rely on other people to do it. We have a new resource available that we're going to show you in a minute. Our Department of Planning and Health has launched the Rockland County Unpaused Dashboard. This new dashboard tracks the 7 metrics used by New York State to determine reopening status as part of the New York Forward Plan. This is what, when you go online, this is what it will look like when you take a look at it. You got it, John?
Yep, that's good.
Okay. On this dashboard, we have the decline in total hospitalizations. That is over here. We have the new hospitalizations. That is over here. Over here, down here, we have the hospital bed capacity, and on this side here, we have the decline in deaths. You probably can't see it here, but there's a green line that goes across, and we are well within the range and then some of where we should be. But again, the important thing is we are going to be utilizing this, and I want to acknowledge our planning department and our health department for their work here, because we're going to be able to use this in real time to see exactly where we stand and how we're doing. If any spiking occurs, as we all know, we've had a number of demonstrations, not just in Rockland, but in other parts of this region, and everybody's wondering what's going to happen. Well, what I can tell you with certainty is that with this new dashboard, it'll help keep you aware of how we are doing locally in regard to these metrics. And it's very important, because this information allows each of us to make more informed choices about our actions and our behavior. It also lets us here know if there are any spiking areas going on. We can address that as rapidly as possible. This tool is a key tool to residents, businesses, and local municipalities. The data is retrieved, tabulated, and updated each weekday afternoon on the dashboard. This is the same data that's used by New York State to determine the regional metrics. But this strategy here, this dashboard, is unique to this county, and I'm very proud of that. And again, as I said, it's virtually real-time information, which is exactly what we need. Rapid deployment of resources to address a problem, something I learned in the police department a long time ago and was very, very successful. Links to the new dashboard have been added to the rocklandgov.com website. It's rocklandgov.com and the Rockland County Department of Health's COVID-19 page. This dashboard is also accessible via direct link, which will be in the comments section, as I said earlier. That will be posted there. So again, this is an exciting development for us here, because it gives us true tools to make sure that this county is healthy and safe. Right now, though, I know we have a number of questions, John. We can get into them right now, I guess.
Okay, let's get to it. First question, which is a frequent one for us: when is the DMV going to open in our area?
Again, we always internally smile about this. People looking to go to the DMV, it's like looking to go to a dentist without Novocaine. But as we do know, the DMV is a state agency. We have no direct control over the agency. We're here to report the information that was given to us in the best way we possibly can. Our West Haverstraw DMV office right now is currently open for mail-in and drop box processing only. Drop box hours are from 8:30 a.m. to 4:30 p.m. Monday through Friday. You can only complete certain services via this process, and those are the following: register a vehicle for the first time, be sure you know what the fee is; surrender your license plates, often required to cancel your insurance; or paying for or providing proof that you paid sales tax on a registration. As regions enter Phase 3, we're told the DMV will still offer limited in-person transactions at that time in the state-run DMV offices by reservation only. So this Phase 3 is scheduled for June 23rd, as I recollect. Yep. So June 23rd is the beginning of Phase 3, barring any kind of change, whether we can move that up or it has to be moved back. That's when you'll be able to get limited in-person transactions in the state DMV by reservation only. You got to prioritize critical services and resume road tests at that time. Customers taking a road test will have their temperature taken and be screened for symptoms of COVID-19. That's going to be something that's become very much the norm around here for at least a bit of time. And any known contacts with COVID-19 patients prior to beginning the road test. Road tests will be scheduled, will be rescheduled if a customer has a fever, temperature of 100 degrees or higher, if you're exhibiting symptoms of COVID-19, or if you had a recent close contact with anyone who was tested positive for COVID-19. The one thing I would urge you to do if you're contemplating going to DMV after the 23rd, or anything you're going to do, just so you don't end up making unnecessary trips, getting aggravated unnecessarily, is go to the DMV website. That's dmv.ny.gov, dmv.ny.gov. Make sure that your trip is necessary and you have all the information you need. Having had the pleasure of going to the DMV myself over the years, the last thing you want to do is get there and have yourself missing a piece of paper, have to go back home and go back again. It's just something that nobody in their right mind wants to do. So it's just a reiteration of that today.
And to add on to that real quickly, the DMV website is very specific about what each individual state-run office is offering in terms of services, in terms of things you can do there. So all that information spelled out. On to the next question. My child is starting to go a little stir-crazy. Not mine, the residents who called in. Any word when I might be able to take them to the park to enjoy the playground or the swing set?
Currently, right now, playgrounds are included under Phase 4 under Recreation. That's July 7th. Now, one thing I will tell you, that was based at the time by the state on the concern of contact transmission of the virus. It is now becoming more apparent that the transmission of the virus on off a surface is becoming less of a concern to the medical experts. So this may change as this information is developed. Rockland County and the region, as I said, we're slated to go into Phase 4 on July 7th. Our county-run parks are currently open, but again, just like the other parks under the New York Forward Plan, we do not yet open the playgrounds that we can operate. So again, these things will happen July 7th or hopefully sooner, and we'll find out if we get any additional information on the lessons of concern on the spread of the virus by contact.
Okay. And sticking with things to do outside, when will the Pyrmont Pier be open for walking?
I want to thank this person for this question because it's rare in times like this I get to give good news. Pyrmont Pier will be open tomorrow, July 10th. So you can go down to the pier tomorrow.
Okay. Now, when will pools be able to open here?
Okay, a lot of confusion about this, but let me be very clear. The condo pools, HOA, private club pools, municipal pools have been authorized to open as of May 28th. Now, again, there's a process to this. It's not that difficult. It really is the same as you do every year. So those who are HOA board members, who I know have been listening to this, the process is very similar to what you do every year. The health department has to give you a permit. The permit is based upon the requirements of the sanitary code. Let's put aside the fact that we had a COVID-19 crisis, and we just forget like it never happened for the moment. You would normally have to have the health department come down. They would check the sanitary issues of the pool, chlorine levels and things of that nature, all the things required under the sanitary code of the state of New York. Again, everything you've done every year. That is over here. That's Part A. Part B is the current, we have to bring the COVID crisis back again. Using that, there are additional concerns and requirements and actually guidelines that are expected to be done. The guidelines you find in the CDC, the Center for Disease Control, pretty much are the guidelines that will be applied by the health department. We have not gotten guidelines from the state of New York yet. They told us we're going to forward them. It's my judgment as a county executive here that it makes no sense for you to have to worry about an 80-degree or 85-degree day and not be able to go in a pool when nothing is stopping us. We know what the rules are. We know to keep you safe and to make sure that things are being done the right way. So at the end of the day, those of you who want to open a pool up, you can. Social distancing, obviously, if you're not in the pool, don't wear a mask. Don't wear a mask in the pool, please. It's not a good idea. It gets stuck to your face, and we don't want to see tragedies, okay, especially with the young ones. But be socially distanced in the pool area. Excuse me, there is a limit on gatherings within the pool area. You cannot have a group of 10 or more congregate in one spot. So that's the only limitation as far as people, in addition to social distancing, that you have to use. And basically, in short, as we said many, many times, exercise common sense. We all kind of know what the rules are. Face covering when you're not in the water, 6 feet away from other people you don't know. If you're there with your spouse, obviously your children, those rules go out the window. We're not looking to make life difficult for anybody. Nobody's going to be coming in there and levying fines if those rules aren't followed. The bottom line is that we're looking to be cooperative and collaborative and to ensure compliance with these very basic steps.
Okay, and moving on, when do you think that stores within the Palisades Center will be able to open? We know this is an ongoing issue across New York State.
Yes. There's something called economic parity. What's going on now is just, it's unacceptable, and we have said this because my colleague across the river in Westchester, we have George Latimer. He has the Galleria Mall. Steve Newhouse in Orange County has indoor malls also. If you have a mall with an exterior door in a particular store, you can do that very easily. But what's happening is retail establishments within the mall who have no exterior doors cannot open up. It's just simply wrong, and we've expressed this to the governor's office. They have not yet agreed to that, and we've made this very clear that we know that enclosed shopping centers have spent considerable time and resources preparing to reopen in a way that is safe both for the employee and for the shoppers. Our local enclosed mall, the largest one obviously, is the Palisades Center. They employ thousands of Rockland residents and contribute millions in property and sales tax to municipalities and the local school district. I've seen their safety plan. It is outstanding. It covers about every base you can imagine. The fact of the matter is that is often more open space within some of these enclosed malls than you find in strip malls. So this whole rationale, bottom line is that there's no difference between allowing a retail store in an enclosed mall to open in phase 2 as compared to retail strip malls and other businesses. It just isn't. We're going to continue to urge in our regional control room calls to allow malls to reopen immediately, and we will continue to do that.
Okay. A number of families out there have been waiting for months now to see their loved ones who are in group homes around Rockland County, across New York State. The person who wrote today, they're wondering if you can please help us by contacting the governor on this regard.
And again, I hear you. As you all do know, it's the local elected officials that field the calls, the county executive, our town supervisors, our village mayors in particular. We have been very direct about this. It is a maddening piece that we're dealing with. We keep bringing this up, and along with other issues. Some have been heard and acted upon. A few have not, and sadly, this has been one of them that has not been acted. I have no new information on group homes. The last info I had was the New York State Office of People with Developmental Disabilities was working with the New York State Department of Health to establish a process to safely begin returning to regular activities, including a phased-in approach to the resumption of programs and visitations. I don't know how much more passionate I can be about this when we speak to the governor's people. I can't even begin to fathom how this is not being acted upon. This is something that can be acted upon. It just takes the decision-making ability of someone up there to get it done. If you think about the pain that families are going through and patients are going through and clients are going through, it really is very frustrating. We'll continue to focus on this. Know that my fellow county executives have been very strong in this, most notably Marcus Molinaro and Duchess, who is a special needs child. So, it's not like it's lacking attention, and it's not like it's lacking any passion. There are a lot of strong words being used to make this point. OPWDD is encouraging family members and others interested parties to sign up to receive regular updates. I'll give you the website. It'll be on the Facebook page, but I'll give it to you anyway. www, obviously, opwdd.ny.gov. Again, opwdd.ny.gov.
Okay, and still a lot of confusion out there about what phase certain businesses and industries are in. So what phase will gyms be able to open? Is there a definite answer? People are hearing different responses.
Yeah, it's a confusing issue because apparently they're treating gyms differently. If you have a residential hotel gym, it's being looked at one way. If you have a gym, like a commercial gym, it's being looked at as another way. I'll be honest with you, I have not been able to figure this out because whether you are going to a commercial gym, whether you're going to a gym within a complex, a housing complex, whether you are, whether you're in a hotel, pretty much almost everybody going to that gym is a known entity in one way, shape, or form. Whether you have a key card to get into the gym, whether you regularly live there. Almost every one of these places have cameras in them, so they can identify who people are. So even if somebody had the virus, the contact tracers will be able to figure out exactly who the interaction was with, because they have an ability to track these people down quite easily. I'm just telling you as a former detective. New York State has said that hotel residential complexes can reopen amenities like gyms and pools during phase 3. However, New York Forward website doesn't specifically say, I just made a mistake here, I think. No, I made a mistake here. The pools are open. Let me correct that.
They are.
That's right. This is how fast things change around here, because originally the pools had to wait until phase 3. Now they're not waiting until phase 3. So let me repeat that. My apologies for that. Hotel and residential complexes can reopen amenities like gyms during phase 3. That's July 23rd. However, the New York Forward website doesn't specifically say what phase gyms are included in, and we believe it will be phase 4, which will include the other gyms, the commercial gyms. The rationale, as I said before, I don't understand. We'll continue to try and get clarity on this issue from New York State and from the governor's office, but again, we will try our best to get the information to you.
Okay. What phase are spas and nail salons included in?
Okay, spas, nail salons, cosmetology, massage therapy, tattoo and piercing facilities, tanning facilities, waxing facilities are all included in phase 3, which will be the 23rd of June. I was on the control room call today, specifically about the nail salon, as I come to find out that some of the veneer tips that are used by the ladies, typically for their nails, if you keep up with them, they're fine. But if you don't tend to them regularly, they start peeling off, and when the nail's growing, and you end up with a potential medical condition. I've seen some photos already where the skin is separating underneath the nail. So we made it very clear to the all-male group that we were speaking to. Thankfully, we had one female county executive on our side to explain to them that this is not a cosmetic issue. This is becoming a potential medical issue. These nails have to be apparently continue to maintain, and they'll be fine. So we made that pitch today. The specific guidelines, though, for these industries are available right now. If people want to go to the Forward, it's forward.ny.gov website. Again, forward.ny.gov website, and under the phase 3 section, you get to take a look at exactly what the timeline is and what guidelines are, more importantly, because we've heard many concerns being expressed from people, both employees and potential customers, about what's going to be done to make them safe, and that's all detailed there.
Okay. Can we also get an update on the opening of the county clerk's office right here in Rockland?
Yeah, the county clerk's office in Rockland, it's been tough because of the loss of a good friend, Paul Peperato. Just a wonderful man, did amazing things with the clerk's office, and we miss him terribly. The county clerk's office is open right now with limited access to in-person services. I was just over there the other day, and everything's functioning. But to schedule an appointment, all you need to do is call 845-638-5221. 638-5221. There are also a number of alternatives to in-office visits with the clerk. You can search, file, record documents, and download applications online at, again, www.rocklandcountyclerk.com. Again, rocklandcountyclerk.com. You can send mail to the Rockland County Clerk at 1 South Main Street, Suite 100, New City, New York, 10956. Again, 1 South Main Street in New City. You can call them at, again, as I said, 845-638-5221. Or you can utilize a drop box that's located in the courthouse parking lot. Just so some people aren't aware where they are. When you come into the Owls Parish building, you come in this a one-way in and a one-way out. If you come in the correct way, you're going to drive right by the side of the building, the Owls Parish building. As you look off to your left, about a 45-degree angle, the county clerk's office is right over there. I even give directions.
Yeah, impressive. Another question on a lot of people's minds: when will hospitals begin to allow visitors again?
Okay. Yeah, again, this is another item that is becoming a source of great frustration for the county executives. 16 hospitals across New York State, took part in a 2-week-long pilot program which allowed visitors. I guess they want to get a sense of any impact under a controlled test. Under the program, visitors to the hospitals got their temperature checked and wore PPE, protective equipment, and masks. Some of the same precautions now being put in place by businesses that have reopened. The program ended last Tuesday, and we've spoken to this already. We spoke to this last Tuesday and last Thursday. We're still expecting results. This is where I get frustrated. How long does it take to find out? So it's been a week, but we are expecting results to be announced by the governor and New York State soon, and I hope sooner rather than later, because again, we're dealing with families, who are in great pain. Their loved ones are in a hospital. We all know what families went through already with this COVID crisis, where their family members passed away and you weren't able to say goodbye to them. It's a terrible thing. So I'm hopeful that the state will move along this as rapidly as they possibly can.
Okay. And the last question, still on a lot of people's minds, and something that doesn't make sense to a lot of people as well.
Yeah.
When can we have larger gatherings beyond that 10-person limit?
We tried to make this simple here. The County of Rockland, we revoked the 10-person limit because we had implemented that when there was no numbers being ascribed to the orders by the governor's emergency orders. So we figured 10 was a reasonable number at that time, maybe a couple of weeks ago, John, if I remember correctly. It just made it a little bit simple for people to understand, because the way it was described by the governor during one of his press events was when he asked about gatherings, like a pickup basketball game. That's 6 people. So, I mean, I think people need more certainty than that. We felt 10 was a large family. So we revoked that with the belief that the state of New York would now come up to be current with the situations we're dealing with right now, how things have been changing, that we're not in that same crisis scenario right now. We're still waiting for that. So we don't know what the limit's going to be. And, the state of New York is still limiting social gatherings to 10 people. And I know there are people out there who, saw the protesting and couldn't understand, well, how come there's a gathering? Look, something, obviously a protest is a little bit different. It's a very unique scenario. I'm not making apologies for that, but as a former police commander, I certainly understand why our officers are not going to be wading into a crowd where people are hurt, angry, and frustrated and trying to tell them to socially distance or put masks on. That would be a recipe for disaster. We've been very blessed here in Rockland County that we've had demonstrations that were peaceful. People have been respectful and very minor interruptions to people's lives here. Even to the extent that any traffic slowdowns are very minor. So, I understand the argument, but I would just suggest to people to think of what it would be like if there was an attempt to do that, and what potentially could happen in times like this. I understand it doesn't make sense, but especially with some of the other regular standards that are going on. But, all we can do is bring these issues to the control room, and we do appreciate your contacting us here and giving us your questions, because the best way we can get good things done is to take information that concerns you. It comes to government, and we can move it along to the state to try to get to understand what the critical concerns are that you have. And we'll continue to do that. So please stay in touch, stay involved. The one thing I will say here in closing is that, have some numbers for you, I don't want to forget that. Okay, rocklandgov.com, rocklandgov.com, that is your county website. That includes a new dashboard we referred to earlier. ny.gov, ny.gov, that is the state government website. If you have an urge and you have nothing better to do and you want to read the emergency orders, you can have at it anytime you want. It's a 24/7 website. More current and compelling, I think, is the forward.ny.gov website. Again, forward.ny.gov. You can see exactly what the business templates are, what the guidelines are, what businesses have to sign off on to open up. There's a lot of information there, especially if you need a comfort level. I mean, this has been a very strange scenario we've been dealing with, and we know there's anxiety out there, and people are not quite sure if it's safe. Again, I've said this before. The only thing, your safety stops when you get out of bed in the morning. All we can do is make good judgments at that point. And one thing we are doing here, anything we do here is guided by what I said earlier. It's safety first and people always. So we'll continue to do that. A couple of phone numbers. The State Department of Health hotline for reservations for testing, for example, and also any questions you have. 888-364-3065. That's 888-364-3065. And also our health department here, 8 to 4, Monday through Friday, 845-238-1956. 238-1956. And finally, what's called the pause hotline. This line is good for complaints. Again, not people who are walking around without mask on. This is something that if a certain business who you believe should not be open is open, or other rules are violated regularly, this is a good line to call because they will vet your complaint, make sure that you're seeing what you should be seeing on that it is in fact a potential violation. From there, your information will be transmitted to 3 points of contact here in Rockland County: our district attorney, our county sheriff, and our deputy commissioner of health for investigative action. And that's it for these. And I just really want to close up. Again, there's a lot we have to do here together right now. There's nobody who has a magic wand out there that's going to make things well. Things are going to be different. They're going to look different. They're going to feel different. But again, as I said earlier, the moment we step out of bed, we start having risk. And what we're doing here in Rockland County and in the region, I will be honest with you about that with my colleagues in government, is that we're looking to take steps that are judicious, that will not unnecessarily risk anybody in their health. And that is where we're going. But the positive thing I can tell you is that things have been getting better. We certainly have improved from the conditions we had even as early as a month ago. Things have changed dramatically. So we're going in the right direction. We're seeing good things happening. I encourage all of you, let's get out. Let's re-engage. Look at those small businesses in particular, the restaurants, the local businesses, our nonprofits. They have been taking a beating. I applaud those who are able to afford it, who went to different stores, took takeout meals, and that was really great because you help those businesses, those restaurants, stay alive. So now we have to complete the task. And let's remember, these small businesses, these local restaurants, and other small companies, they're the ones who are here for us. When your child needs a sponsorship for his or her baseball team, when there's a journal for your favorite non-for-profit, a journal ad you want to get, if you hear those sirens go off and you see a couple of guys and gals running out the store, they're going to the firehouse. Those are volunteer firefighters, and they thrive here because the businesses understand we are one community, and we are one county, and we are here together, and they get that. So whatever you can do to bulk up their situation is greatly appreciated by everybody here. Because we really doing well in Rockland County. We took a blow. We're going to come back, and we're going to be stronger than ever. But we only do that when we work together. So with that, have a wonderful afternoon, and we'll be seeing you on Thursday at 4:15.